Uh, Hello, good evening, everyone. Thank you for joining today's webinar. My name is Dr. Sushant Sadotra, and today I will be talking about feline hyperthyroidism in detail. So let me share my screen with you guys in a bit. Yes. Okay. Thank you for your patience, and let's start the talk. So, first of all, in the overview of my talk, I will be giving you a brief introduction of thyroid gland and its pathophysiology. Then we will talk about the abnormalities related to it, and also about the diagnosis and the treatment, which are currently used by the veterinarians in this case in hyperthyroidism. And later a small take-home message so that in case you are a cat owner, you can follow those steps to take care of your small compassion animal. So, thyroid gland, as you know, is one of the most important gland present in mammals. So, as in of cat also, this gland is present in near the neck region, and you can see that the anterior view of the gland, which is usually made up of two lobes, which is connected by a narrow band called the I, isthmus. So the lobes are located on each side of the trachea and just like interior of the larynx. So the thyroid gland is, as you know, that one of the largest endocrine gland, and it appears like more red than the surrounding tissues because it is highly vascular, and it is surrounded by connective tissues, capsules, etc. near around it. In the posterior view, you can see that thyroid gland is also has four small yellow colorish lobes, which are known as parathyroid gland, which is another endocrine gland in the body. So as we know, the main function of the thyroid gland is to produce thyroid hormone. So to know more details about the production of thyroid hormone, we first see the anatomy of thyroid cells. So here you can see the dissection of thyroid cells, where you can see it is usually have follicular cells. So thyroid hormones are synthesized and stored within the gland in these numerous thyroid follicles, which are actually small spheres uh, with walls composed of single epithelial layer. And each thyroid follicle is filled with the protein thyroglobulin, to which the thyroid gland is actually attached. So, and here you can see in between these follicular cells, there is a huge network of some loose connective tissues that contain a lot of blood capillaries and scattered around these follicular cells are also parafollicular cells, uh, or also called C cells, which secretes another thyroid hormone, which is known as calcitonin. So talking about the regulation of the secretion or production of these thyroid hormones, so actually it started from the hypothalamus, where the central nervous system or the external stresses give signal to the hypothalamus to produce uh, TSH releasing hormone, also known as TRH, which then travel through blood to the anterior pituitary, and it stimulates the secretion of thyroid stimulating hormone, TSH. So TSH stimulates the secretion of thyroid hormones from the thyroid gland. Okay, so the small fluctuation whenever happens in the blood where the levels of TRH or TSH goes up and down, it also affects the production of thyroid hormones. And as you can see that these thyroid hormone can also have a negative feedback over to the production or the action of TRH and TSH. So thyroid hormone actually controls a lot of functions in the body, starting from cardiovascular, breathing, respiratory. Most important is the metabolism, and also secondary functions such as menstruation cycles in females, body temperature, and also brain development. So these functions are mostly controlled by T3 and T4, the two thyroid hormones. Other than that, calcitonin, the third hormone, which is produced by thyroid gland, also maintain the calcium levels in blood. So overall, you can see that thyroid hormones are participating in most of the vital functions in the body. That's why a small injury or a small kind of disorder in thyroid gland can cause a lot of disorders or diseases in the body. So for that, we need a quite precautious to maintain the to to early identify these kind of disorders. So one of the disorder we're going to talk about today is hyperthyroidism, and especially with respect to the cats, we will discuss it in more detail. So as the name suggests, hyperthyroidism, it is the hyperfunction of thyroid gland where an excessive production and secretion of thyroid hormone, both T3 and T4, is happening. So due to this hyperfunction, the thyroid hormone, the concentration will increase in the blood, and the thyroid hormone will be circulating at high concentration, which will increase indeed the metabolic rate. Yeah, and as it is mentioned that it is mostly occurring in the middle age and the older cats. However, it is rarely happening in dogs. The reason behind that is still unknown. Yeah. So talking about the overall condition of hyperthyroidism, the age of the cat is usually from 4 to 22 years, which are prone to have hyperthyroidism. However, it is seen that below the age of 8 years, there are actually only 5% of the cases of hyperthyroidism. And also the pure breeds of the cats have low risk of developing hyperthyroidism, such as Himalayan cats or Siamese. Yeah. So, sorry. So clinical features in hyperthyroidism are basically, you can see the most visible is the enlargement of the neck region, which is, we also call it goiter or palpable enlargement of the thyroid gland. With that, there will be a sudden weight loss in the cat. However, the appetite of the cat will be increased, and also the urination and the drinking. The cat will be drinking excess of water. Following that, the gastrointestinal symptoms will also increase, such as vomiting, diarrhea, and also increase in the fecal volume. You will see that the cat is very hyperactive, which will also affect its cardiovascular system, such as there will be an increase in heart rate, and it can be lead to heart failure also. So as I mentioned, some of the clinical features here, based on the percentage, it is happening in most of the cats. So the weight loss or the increase in the appetite is the most visible or noticeable symptoms, which is happening in most of the cats. Other than that, the gastrointestinal and the cardiovascular symptoms are other clinical features which are high percentage in cats. Here you can see there are two examples I have shown where you can see the cat is looking very thin, has lost a lot of weight. And in the other example, you can see there is a ventrofixation of the head, where the cat has a dropped head and cannot bear the weight of the head. Yeah. So there are many causes which researchers have been uh, dedicated to the feline hyperthyroidism. However, first of all, the primary uh, cause, which everybody we know, that is a thyroid dysfunctioning. Second cause can be a genetic, where a small mutation, which can be a point mutation or multiple mutations in thyroid follicular cells, or because of the surgery of the thyroid gland or some injury into the thyroid gland, can cause some mutation in the thyroid gland. Other than that, nutritional deficiencies or excess can also cause thyroid issues, such as iodine, which is the most important nutrition for the thyroid gland. So its fluctuation in the diet can cause some chronic diseases in thyroid gland. Also, soya diets interact with other factors such as iodine deficiency. Also, some of the carcinogenic agents such as BPA, BDPs can also disrupt thyroid functioning. So, as I said, that due to the hyperfunction of the thyroid gland, it is basically happening due to the multiplication of the follicular cells, which leads to the tumor formation. Yeah. So the primary cause of the hyperthyroidism is the autonomous condition, where there can be a growth in the hyperthyroid gland. It can be a benign, or it can be malignant. Other than that, the other rare factors could be related to the pituitary adenoma, where a pituitary gland will have some kind of issues which is affecting indirectly to the thyroid gland. Here you can see the benign kind of a tumor, if it's happening, which is the most common case in hyperthyroidism, where a follicular growth can be from 1 mm to 3 centimeter. And also it can be bilateral or unilateral, which means that both lobes of the thyroid gland will have follicular cell growth. So which is a 70% of the case. And 30% of the cases will be unilateral, where only one lobe of the thyroid gland will have multiple follicular adenoma. However, if the tumor growth is malignant, it can be 1 to 3% in hyperthyroid cats, where you can see that this malignant tumor will not be situated only on the thyroid gland. However, it will invade the adjoining blood vessels and the connective tissues, or the capsules around thyroid gland. So when the tumor will grow more, it will lead to the thyroid carcinoma, which is more dangerous situation in hyperthyroid cases. So as we discussed right now, the clinical signs and the causes of hyperthyroidism, let's talk more about the diagnosis of this disorder. So of course, the first identification towards the diagnosis is the physical appearance of the cat. You can see in this example where the cat, which is in a normal condition, looks very beautiful and cute. However, in case of hyperthyroidism, the cat will have a different appearance, where you can see there will be a loss of weight and other physical views of the cats. Yeah. Here I will share again the some of the symptoms which will lead to the physical diagnosis, where you can see, first of all, the goiter formation or the palpable thyroid, which is a 91% of the cases. Also, the weight loss and trachycardial symptoms will be the 71 to 48%. Also, if you check the cardiovascular signs such as heart rate and other things would be another 40% of the cats will show such symptoms. And skin changes and also the hair coat, thin skin, etc., small kidneys will also be the 30 to 26%. So yeah, in short, based on the physical examination, you can diagnose that this case could be a hyperthyroid case. When you are confirmed with that, you can basically have to go further with your diagnosis, where you can check the serum chemistry and also the complete blood count. So in this case, when you check the serum chemistry, basically we check the liver enzymes such as ALT and APL, which always show the high percentages in the blood, in the serum. And also in the complete blood count, the platelet count and the red blood cells and the white blood cell will also be evaluated in 30, 39 or 40% cases. More than that, you can also check the urine analysis, where you can see the specific gravity will also increase from 1.035, which is a case in more than 60% of the cat. So once the physical examination and the blood chemistry has been diagnosed and it shows the symptoms of hyperthyroidism, we can further choose differential diagnosis examples where we can further go to check the thyroid hormones and their concentration in the blood. So of course, first of all, we will check the total T4, which is the thyroxine concentrations in the blood. So healthy cats usually have the reference range of T4 from 1 to 4.5 microgram per DL. However, if the case is hyperthyroid, then the percentage of T4 concentration will always be very high as compared to the normal cat and in case of other illnesses. For example, in this case study, you can see that in normal and the other illnesses falls in a gray region, which is a reference range for total T4. However, in the middle, which is the case of hyperthyroid cat, you can see the T4 levels are evaluated 4 times. So in our laboratories at BioGuard, we have our device, which is known as BioGuard V-Scan Analyzer. This is the immunofluorescent analyzer, which can detect most of the endocrine biomarkers from the pet samples. So for the T4 calculations, we use this device which can calculate the accurately quantitative levels of T4 into the blood. So after T4 concentrations are high, which can also be, there are many factors which can affect the levels of T4 in the blood. So it can be non-thyroidical illnesses syndrome. Also, it also depends on the cat's age, the levels of T4. Other than that, if cat is on medication of certain drugs, such as glucocorticoids, that will also affect the levels of T4. So basically, high levels of T4 doesn't mean that the cat is suffering from hyperthyroidism. So to go further, we need to analyze more situations where we can further clarify and the proper diagnosis of hyperthyroidism. However, what if the T4 levels are within the reference range and it's not high? Then we can attain certain approaches, such as we can measure the serum free T4 concentrations, also TSH serum levels, and TRS stimulating test, or the last, we can use thyroid uh, scintigraphy, where we can use radioactive iodine to check the levels, to check the dysfunctioning of thyroid gland. Let's go in detail one by one about these tests. So first of all, why FT4 concentration or free T4 concentration give you more relevant results than total T4. The case is in this case, you can see that because the total T4 actually can be altered because of the metabolic activities in an organism. So usually total T4 is binded to plasma carrier proteins, which are usually transported in between the cells. And also it can also be binding to the intracellular binding. So measuring free T4 will provide you more consistent percentage of high T4 levels. So as you can see in this case study where the cats were analyzed for free T4, and you can see that in the normal case and also in the other illnesses case, the cat the cat will show you the reference range of free T4 in the range of T4 in the reference levels. However, in case of hyperthyroid cat, the percentage or the levels of free T4 will be quite high. So this can definitely confirm that the case is of hyperthyroidism. Okay, other than that, thyroid stimulating hormone or TSH levels can also be checked in case of hyperthyroidism. However, this test is mostly useful or a golden standard for hypothyroidism, where it is actually high. However, in case of hyperthyroidism, TH level should be low. So because why it is so? It is because of the negative feedback of the T4 hormone. So as I have told you before, that high levels of T4 will decrease the levels of TSH. So when there is an abnormality in thyroid gland, where usually there are high levels of T4, it should naturally decrease the levels of TSH. So suggested reference range for TSH is 0.03 to zero point 0.3 ng per ml, nanogram per ml. And in case of 98% of the hyperthyroid gland will show you the low levels of TSH, lower than the reference range. However, this test is still have a poor sensitivity, and also one third of the euthyroid cats have undetectable TSH levels. So of course we cannot rely on these tests alone. So we need to check it further to further confirm our diagnosis. TRS stimulating test is another important test which can be further used to diagnose hyperthyroidism in cats, where you can see that that in the blood we will induce and administrate recombinant TRSH through IV, uh, but we will take the T4 level samples before and after the administration. So after 4 hours of the administration of TRH in the blood of the cat, you can see that the levels of the normal T4 and in case of other illnesses, the T4 level will increase. However, before the administration, these T4 levels are always in a reference range. So this will confirm you that in case of hyperthyroid cat, the TRH in the administration will not affect the levels of T4 because the thyroid gland is already hyperactive. So the interpretation is also very easy that healthy cats and non-thyroid illness, in those cats, there will be a twofold increase in the serum T4 concentrations. Last but not the least, you can use radioactivity to check the imaging of the thyroid gland. And as you know that this technology is also used in other cases of cancer detection. So in similar way, we can use radioactive iodine, such as isotopes of iodine 131 and 123, can be used to get a very nice pictures of thyroid gland. Here I have shown you some example where you can see a small induction, a small, the small size of the thyroid gland, where you have where the research paper had used some of the isotopes of iodine to get a very nice picture. However, in case of thyroid malfunctioning, you can see the thyroid gland has increased the size, but still it's in a medium size of enlargement. However, in case of adenoma formation, you can see the size is quite high in the third picture. And in case of carcinoma, it is way more high to identify that this is the most serious case of hyperthyroidism or enlargement of the thyroid gland. So this technique is very useful as it can detect the localization of the thyroid, uh, localization of the growth of the thyroid tissue. So you will know that whether it is unilateral or bilateral, or it is benign or malignant. So that, and also the efficiency of some of the therapies. If suppose you are giving some therapy, thyroid therapy to the cats, so you can check the efficiency of the therapy by checking the size of the thyroid gland. And also it will evaluate the residual tissue. If suppose there is a surgery that you have done on thyroid gland, you can check if there is a residual tissue still left in the after the surgery. So this technique is also be useful for the post treatment cross check or in the cats. Similar to this technique is also ultrasonography, where you can check the volume of the thyroid gland. Here, the imaging needs expertise, where we know that the normal thyroid lobes usually have the volume of 40 to 140 millimeter cubic millimeter. However, in case of abnormal thyroid lobes, this volume will increase from 140 to 1000 cubic millimeter. So yeah, this technique also can be used to identify the uh, growth in in growth in thyroid gland, which will of course lead to the hyperthyroidism. So here in 2016, AAFP have given us some of the guidelines which are very useful for the diagnosis of hyperthyroidism. It has divided the cases into six groups. Sorry, it has divided the cases into six groups. So you can see in the group one, uh, which is a classical case where there is a hyperthyroidism clinical signs, and also there is a evaluated uh, T4 levels. So of course, this is a very clear-cut case of hyperthyroidism where it is recommended to start the treatment as soon as possible. However, in group two, where you will know that there will be a possibility of hyperthyroidism, where you have clinical signs for hyperthyroidism. However, the T4 levels are still normal. So in this case, you can check the free T4 levels for from second week to fourth week after the initial examination that you have done. And you can further monitor with other tests such as 3,3 suppression test or the thyroid scintigraphy test to further evaluate in this case. In case of group 3, where you will see the enlargement of the thyroid gland. However, there are no symptoms of hyperthyroidism. So in this case, the T4 levels will also be normal as there are no symptoms of hyperthyroidism. So in this case, it is recommended that you monitor the clinical signs for another 6 months and also repeat the T4 assay to see whether the levels are going high or not. In group 4, where you will see some of the symptoms for hyperthyroidism, but still you are not sure whether it's hyperthyroidism or not. However, you will see seldom evaluation of T4 levels. So to further confirm with the symptoms and the evaluated levels of T4, you have to repeat the T4 test here, and also the levels of T4 levels, if normal, then you need to retest, reevaluate the test after 6 months to further confirm the presence of hyperthyroidism. In case of group 5, where the cats will have clinical signs of hyperthyroidism with confirmed non-thyroidism disease also. So if the cat is concurrently having two diseases simultaneously, which are also affecting or showing symptoms of hyperthyroidism. So you need to give a treatment in a way that the co-current disease and also the hyperthyroidism disease will be treated simultaneously. So this is a very critical case where you need to check and consider a lot of factors before you start the treatment. In case of group 6, which is a clinically normal, you will see that there is no clinical sign of hyperthyroidism, and there is enlargement of the hyperthyroidism. No enlargement of the thyroid gland. However, the T4 levels are still high. So in this case, you need to confirm the T4 levels are evaluated, but because of what reason? It can be a non-theoretical issue. So you need to further monitor the clinical signs and also repeat the test for T4 in next 6 months. So if the levels of T4 are still high after 6 months, you can start with the treatment of hyperthyroidism without any doubt. Yeah. So as I mentioned that there are many factors and reasons which will be responsible for the proper diagnosis of the hyperthyroidism. However, once you are confirmed that, yeah, the cat or your pet have hyperthyroidism, then of course we need to consider the management of this disease. So for the treatment of hyperthyroidism, mostly there are four methods which are used in clinics or by the veterinarians these days. So in short, these methods are: first is the oral anti-thyroid drugs, which are very easily available in the market. Second is the surgery method. Yeah. So, and the third one is the radioactive iodine treatment. And fourth one is the nutritional management with iodine limited diet. So all the methods have their advantages and disadvantages. So based on the critical cases or the initial diagnosis, the veterinarian will choose a proper treatment therapy for the patient. So let's go through one by one through each method. So first we will talk about the anti-thyroid drugs. Before let you know about the drugs, I will like to mention how these drugs are actually controlling hyperthyroidism. So as you know, these drugs are given orally. So once it is entered or absorbed by the body into the blood, as you can see in the green, it enters into the follicular cells of thyroid gland, where it can block the production of thyroid hormone in three ways. First of all, it will control the oxidation of iron into iodine. And second, it will control or block the organoification of iodine, where you can see it will block the iodine to go into the protein structure. And at the third step, it will block the change change of iodothionides into the to form T4 and T3. So there are three steps where the drugs can interfere in the production or into the mechanism of hyperthyroidism or the production of thyroid hormones. So let me give you some of the common drugs which are available into the market. So first of all is first drug, which is very easily available in the market, is methimazole, also known as tepazole. So this drug is present as an oral dosage, which is available in the tablets or 2.5 mg to 5 mg sugar-coated tablets. And also the for the starting range and the recommendation dose uh, is 1.25 to 2.5 mg, which has to be administered once or twice a day, and for 2 to 3 weeks. But also, you need to see how much there are high levels of hyperthyroidism. Based on that, the dose can be decided. Once you have given the treatment for 2 to 3 weeks, you can taper the drug, whether you need to increase or decrease based on the reduction of clinical signs. Signs. Yeah. Here are one of the case study where you can see that 64 cats, hyperthyroid cats, are first have shown the high levels of T4 before the treatment with methimazole, and later, by the course of time, within 30, 30 to 36 days, you can see that most of the cats were got treated very, very nicely and come into the normal range of T4 levels because of this drug. However, these drugs still have some advantages and disadvantages. So the advantages is, of course, is that uh, this method or the drug is 95% is effective, and cats will show you a very good signs of reduction in clinical signs. Of course, this drug is present as small tablets, so there is no need of anesthesia or surgery. The drug can be given orally, and it doesn't require any hospitalization, and there is no risk of permanent hypothyroidism. So once you stop the drug, you can actually, the thyroid will maybe can can also again have hyperthyroidism. However, it is not a reversible case. So, and also it will not affect the kidneys. The drug will has no interference in kidney functioning. However, this drug have some kind of reaction, such as it will lead to vomiting and depression in the cat. And also, there will be a frequent lab tests need to be monitored for the efficacy and safety of this drug. And you need to clearly check the drug reaction because it has seen that 25% of the cases of hypothyroidism, the cat have shown some kind of reaction towards this drug. Okay, let's talk about another drug which is available in the market, which is carbimazole. So this drug is actually the equivalent to methimazole. However, 5 mg of carbimazole is actually similar to 3 mg of methimazole. So that's why the recommendation dose is quite high uh, for 8 to 12 hours, which is similar as twice a day for 2 to 3 weeks uh, of duration. However, this drug is mostly prevalent in Europe and Australia and not in US because of the adverse effect uh, on the gastrointestinal and also some of the uh, central nervous system effects. This drug is still not recommended compared to methimazole. The third drug is pyro phyl thiouracil, which is also commonly known as PTU, is very effective in blocking the synthesis of synthesis of thyroid hormone in cats. However, this drug is have the most severe effect compared to the previous mentioned drug. So that's why it is also not recommended for the long-term treatment in the cats. So Basically, the oral treatment is given when the cat will have some kind of initial diagnosis or early stage of hyperthyroidism. However, if the case is more into in a middle stage, then you can actually go for treatment with radioactive iodine. So in this case, we will use the radioactive iodine isotopes such as iodine 131, which is administrated into the cat's body. And here you can know that after the administration, these radioisotopes will enter into the thyroid follicular cells, where it will get incorporate into the thyroglobulin, thyroglobulins, and it will start emitting the gamma rays and beta particles. So because of the ionization effect of gamma rays and beta particles, the follicular cells will have a apoptosis or the cell death. So since these are the carcinoma cells, so because of that, there will be a control in the thyroid hormone, sorry, growth in the hypergrowth of the thyroid gland. So this treatment is also very effective, as you can see in the case study here, where you can clearly see that initially the cats without the treatment have shown the high levels of T4. However, when the radioactive iodine is induced in from day one to for 1 month, within 1 month, most of the cats uh, come into the reference range of T4 levels. However, in this case, sorry, the dose determination for the radioactive iodine has to be still monitored. So there are many factors which can help practitioners or veterinarians to decide the dose determination based on the clinical science, whether they are mild, moderate, or severe. You can choose the percentage of dosage to administrate. Also, you can check the serum levels of T4 concentration. So if the serum concentration is high, but not too high, you can have the low dosage. But and when it is 125 to 250 nanomolar per liter, then you can choose the second level of a dosage administration. And of course, when it's fourfold or eightfold high, then you need to have the high levels of radioactive iodine also. Next, the third parameter which you can choose to decide the dose determination is the thyroid tumor size or the growth of the thyroid gland. So based on that, also the volume, you can see which level of how much radioactive iodine you need to introduce into the cat. So as I say that this method also has some kind of advantages and disadvantages. So as you know that this method is very effective as it can kill most of the abnormal cells at any location. So 94% of the cats will have successful treatment for carcinoma in this case. And also there are no serious side effects because it is very targeted and there is no need of anesthesia or surgery again. And this is a very definite therapy. However, it also has some disadvantages as you know that this technique is very sophisticated. It needs expertise to perform this kind of technique. However, if there is some kind of a radioactive exposure to the user or to the patient, it needs further hospitalization of the owner or of the cat or anybody who get exposed to the radiation. Also, after the treatment, the owner has to keep the cat separate. It cannot touch the cat or cuddle with the cat for a long time, or within the 2 weeks. Yeah. And also, if there are some major effects, there is no reversible treatment for those effects because of this treatment. Yeah. So let's talk about the third method of uh, to treat the hyperthyroid cases, which is the surgical method. So of course, this method is also when there is a, hyper growth of hyper thyroid gland. So basically, you also have to monitor a lot of factors before choosing this uh, surgical method. However, the basic one is the kind of surgery you want to do. So it can be intracapsular or extracapsular. In the intracapsular therapy or the surgery method, the thyroid gland is actually teased out with the help of a sterile cotton tape, and this method is actually more likely will not disturb the parathyroid gland. Uh, and also the rate of recuration is very high. However, in other method, which is extracapsular, the entire lobe of the thyroid gland can be removed, or the part of the thyroid gland can be removed, which will can also include parathyroid gland. Yeah. So yeah, this method is basically used in the malignant kind of tumors where there is no choice, but you have to remove the part of the thyroid gland from the main organ. Yeah. So of course, this method also have some advantages and disadvantages. So advantages is that this is also very effective method where it has seen that 90% of the cats have got cured, and 30 to 60% of the cure rate if only one gland is removed. As I told you that in second case, when you have to remove the part of the thyroid gland, so 30 to 60% of there is a rate of curacy. And the cat can be cured in 1 to 2 days, which means the levels of T4 will come to normal within 1 to 2 days. And also, this is a you don't need any sophistication equipment or advanced equipment because this is a very basic surgery can be done in hospital. However, there are many disadvantages, which is also based on the condition of the cat. If suppose the cat is very old or very fragile to anesthesia, so there can be a risk uh, like risk of effects on central nervous system or organ failure because of the anesthesia. This damage can also, the damage of the surgery can also be seen to the parathyroid gland, where if the parathyroid gland is affected by the surgery, it will affect the overall functioning of the body. And most cats require stabilization first with medication. As you know that after the surgery, the cat has to be given certain medication so that the cat should feel okay. And also the post effects of the surgery have also been seen, where there could be a change in the voice, or there can be other complications because of the surgery. Yeah, yeah. So yeah, this method also have many advantages and disadvantages. The last but not the least is the method which is commonly used for the treatment of hyperthyroid cases in cats is the nutritional management, where a low iodine diet is given to the cat who has high levels of T4. So as you can see in this case study I have shared with you guys, where you can see initially the cat have high levels of T4. However, when the treatment is started and within 8 weeks, you can see the levels of T4 have come to the reference range. However, this treatment is lifelong, or you can see it's a very long-term process, and continuously you have to give cat the same kind, similar diet or low iodine diet throughout his lifespan. Yeah, so that is like one of the disadvantages which I just mentioned to you. Other than that, there are some other disadvantages. Is that this is the only diet which cat can eat. So other than that, the cat, if started eating other diet or snacks, yeah, it will very easily can shuffle the levels of reducing T4 into the cat's body. So that's why when you have to choose the treats of the cat, it also have to be iodine, low iodine treats. And also there is no replacement of the diet. You cannot replace the diet with other kind of diets once you see that the clinical signs have changed and TPO levels have come to normal. So it doesn't mean that you need to replace the diet to the normal. Yeah. However, the advantages of this uh, treatment is that the cat will have like 82% of the cases I've seen that uh, the cat have improved signs. And of course, this is a very clean method. You don't need any kind of anesthesia or surgery, and no dosage, no administration of radioactivity or oral tablets has to be given to the cat. So this is a very safe method also for the renal inefficiency. So if the cat has some kind of kidney diseases or other cardiovascular diseases because of the elderly age cat or in some special cases, so this treatment is quite effective. However, people always have a controversial, opinion that why don't we choose this treatment than other treatments? It's because that this treatment is quite expensive in a way that this is a long-term treatment. So but before the other treatments such as radioactivity, iodine usage, or surgical methods, you may spend some money initially. However, that treatment is have to be done once or twice, no more than that, for the efficacy of the treatment. However, if you consider that, okay, initially you may don't are not spending so much on the diet. However, if you calculate like whole year you need to give similar kind of diet to the cat, it will come to the same price as you will pay for the other methods of treatments. Yeah. So with that, I would like to discuss some of the key points which you need to consider in this case of hyperthyroidism in cats. So, as you know that, uh, sorry, that feline hyperthyroidism is actually one of the most common endocrine disorder these days, found in middle-aged cats and older cats. And in the cause is still not very clear or unknown. However, the basic one is the growth, the hyperactivity of the hyperthyroid gland, uh, of the thyroid gland. It's because of the hypergrowth of the follicular cells uh, in the thyroid gland. So that's why if you have noticed the physical appearances or the clinical signs, you have to timely diagnose and interpret the disease. And of course, with the help of these diagnosis methods, which we talk about today, including uh, the calculations of concentration of T4 levels, free T4 levels, TSH levels, or other blood tests where you can check the blood cells count or hyperactivity of the liver enzymes. So in collaboration with all these tests can definitely diagnose the case of hyperthyroidism. However, you also have to consider the cat if have a concurrent disease or non-thyroidical issues. Like suppose usually in case of elderly cats, they have a lot of other diseases uh, also in the body, which can also affect the thyroid gland. So basically, the diagnosis have to be go through other kind of interpretations or the condition of the cat to definitely know that the case is the hyperthyroid case. After we have confirmed it that the case is of hyperthyroidism, we can go for the treatment methods, which are basically four methods available based on the choice and the condition of the patient. So basic two methods for the mild cases can be anti-thyroid medication or nutritional management with a low iodine diet. However, in case of severe cases, you can choose surgical methods or methods of using radioactive iodine. Yeah. So basically, regular monitoring of hyperthyroid cats after the treatment is also very important, as you know that after the therapy, there is a chance that cat might go back to hyperthyroid condition again. And also, you need to monitor that after the therapy, whether the thyroid gland is functioning okay or not in the case that it is shifting from hyperthyroidism to the hypothyroidism. So, there is both a possibility of going up or going down in case of the post-treatment effects in case of hypothyroidism. However, the morbidity and the mortality can be well managed if we can strongly influenced by the presence or the severity of the other kind of diseases present in the case. So as I mentioned that in most of the cases in elderly cats, so the morbidity rate or the mortality rate is quite high as compared to the middle age or the young cats after the treatment of hypothyroidism. Yeah. So I hope you have gained some information and uh, about this endocrine disorder, uh, or basically with related to cats or feline. So I would like to thank you for listening to today's lecture, and you are most welcome to follow BioGuard's social media pages because there we always keep updating our upcoming events and product information and services. Yes, and with that, I would like to thank you everybody for the joining. And if you have uh, any questions, please comment in the comment box. So I will be answering your questions from now on. Yeah.
Yes, it's a very great speech. And we have the audience have some questions. So I will let you answer your question directly. And Dr. Dewey, now you can answer the question. You can speak. Hello, Dr. Dewey. Now you can you can ask the question.
Okay, so there is one question here. By nutritional management way, how long would it take to resolve the hyperthyroidism symptoms? Okay, so as I told you that this method is basically chosen by the choose veterinarians usually choose this method in an initial or the mild cases. So within 2 to 3 weeks, the clinical science will get start improved, and based on like 8 weeks of the treatment. However, as I told you that this treatment you need to keep continuing. Yeah, so after you see that there is a reduction in symptoms or clinical signs, it doesn't mean that you need to stop the treatment. Yeah. So, what is a commercial diet we could give to the hyperthyroid cat? Okay, so commercial diets, yeah, there are many brands. So, of course, we will not endorse any brands here. So you can check on internet. Most of the uh, known brands for pets food have a very special diet for hyperthyroid cases, which you can easily order online. Yes, so please check it online on those websites. Yes. What are the most common mistakes from diagnosing hyperthyroidism? Yeah, so the most common mistake I would say is the identification of or deciding a hyperthyroid case without checking the history of the cat, or if the cat is suffering from any concurrent diseases. As I mentioned, that some of the effects of adrenal gland, or if there is some kidney dysfunctioning in the cat, which can also lead to the functioning of the thyroid gland indirectly, and lead to the high levels of T4 levels. So that's why we need to monitor other cases and also check other factors before diagnosing, uh, before giving a verdict on the case of hyperthyroidism. Okay, someone has requested for the copy of presentation. Yes, we will send you the copy of presentation. However, I would like to mention that if you have registered, so we would have your email address. So yeah, we will be sending you to the email address with that uh, you have registered. Okay, so okay, and if you haven't registered and you may require the, sorry, the presentation, so you just leave the email address in the comment box. So we will be sending you the presentation later. Yes, sorry. I'm reading the questions. Yeah. So what examples of non-thyroidical illnesses syndrome? So it can be the most common one are the renal diseases, and other kind of are the euthyroid diseases, such as itotropic diseases of thyroid gland issues. So the number of uh, it can also be the case of diabetes mellitus and hepapatho. What was that? I forgot the name. Hyperpatho, which is like 50% cases have seen of 54% of cases I've seen with this one. And other than that, 40% cases I've also seen with a systematic neoplasmia. Yeah. So there's another one, another request for the presentation. Yes, please leave your email address in the comment box. And if you haven't registered, uh, is there any possibility that thyroid is in a trouble, but the size is normal? How to differentiate it with renal, real non-thyroid? Okay, so as I mentioned in my presentation, you can see they were like, I talk about different groups. So in that one, where you are saying that the size is normal, right? Uh, what is it? The thyroid is in a trouble, but the size is normal. Okay, the thyroid is in a trouble, which means that what I suppose that there is a high levels of T4, right? And the size is normal. So in this case, you need to free T4 levels are also high or not. So, and also the clinical signs. So if you have no clinical signs, you need to keep monitoring the free T4 levels. with other tests which I mentioned in my presentation. So which means that there will be a initiation of this kind of disorder. So yes, you can keep monitoring the high levels of T4 for next 6 months, and then you can start the treatment. However, if the levels are still normal, uh, and and there is no further growth of what you say of the thyroid gland, so that means the cat might have other non-thyroid illnesses. Yeah, so you need to check for other markers or other kind of diagnosis to see whether the cat has any other diseases or not. So is there any further question? What is the most common mistake from diagnosing hyperthyroidism? I think this one I answered. How often should we check the thyroid hormone? Every 6 months or yearly? Okay, in a normal case, I guess there is no need to check the thyroid hormone levels. However, if you are a cat owner and you are seeing some of the changes in your cat behavior, so basically the changes could be like starting from the increase in the diet. However, the cat is losing weight, then you can imagine that probably there can be an issue with thyroid gland, which that means you need to monitor the thyroid hormone to see why it's happening. And also particularly in case of hyperthyroidism, you will see the cat is very hyperactive. So because of the hyperactivity, because usually you may know that your cat is not very hyperactive or very calm, and like just play when she plays. But in case of hyperthyroidism, the cat will be hyperactive throughout the day. Yeah, that will be another indication that you need to probably think that it could be because of hyperthyroidism, and you can check for thyroid hormones. Yeah. Yeah, so there's another question. Do you have an experience to treat hyperthyroid cats with hypotoxic hypotoxicity due to the methamizole? And how to distinguish the evaluated ATL is due to drug side effect or hyperthyroidism in is not controlling well? Okay, so basically our company or our diagnosing labs, usually we have the samples for calculating the parameters for hyperthyroidism. However, we don't give the treatment, like suggestions or treatment methods for those patients samples we received. So that's why we don't have an experience in treating the hyperthyroid cat. However, for the second part of the question, where you have asked how to distinguish the evaluated ATL is due to the drug side effect or hyperthyroid case. So of course, the drug is for the hyperthyroid case, right? So it's not. I think it's the same thing you are saying. However, evaluated ATL levels could be because of liver dysfunctioning. So you need to check the liver functioning of the cat and to distinguish between whether the high ATL levels are uh, because of hyperthyroidism, or the treatment you are giving to the cat because of hyperthyroidism, or it is independently a case of liver disease in the cat. Yes. Okay, so with that, I think we already have crossed the time limit. So I would like to thank you again for joining our webinar today. And of course, next month we have another webinar for talking about Babesia cases in the dog. So yeah, if you are interested, to join, to know more about babesiosis in dogs, you are most welcome to register. The links and the informations are all there on our website, on our Facebook and LinkedIn pages. And also, I would like to mention that the talk will be in Turkish language. However, we would try to have subtitles later on with our recorded videos uh, of our webinar. So uh, you can know more about this case through our next webinar next month. So thank you very much, everybody, for joining, and see you again in my next talk. So I say you good night and bye-bye to everybody.
Thank you everyone for participating tonight's webinar. Wish you have a nice day and good night. Bye.
Bye-bye. Bye-bye.